And welcome into To Your Health. Well, for the past 3 weeks, we've learned how the heart ages, signs and symptoms you may be having trouble with your heart, and then what can be done if you do have trouble. But how about let's prevent the trouble? My guest is Dr. Paul Moore. You are a cardiologist, and Dr. Moore, over the past weeks, we've found out a lot of different things about this ticker, but the most important thing we can do is keep it healthy.
Correct. And it starts young. It starts when you're in your habits start when you're a child, really, and your family's habits. Nutrition, food, is very, very, very important, and habits of lifestyle, avoiding cigarettes, avoiding tobacco of any kind, and exercise. Exercise is critically important. I mentioned on an earlier segment about how important exercise was for treatment of people who have cardiovascular disease, but exercise is also very important for prevention. And so your habits, starting when you're a child, adolescent, if you avoid very high calorie content foods, fatty foods, and of course a big concern from a public health standpoint these days, especially in Alabama, is obesity.
Right.
And avoiding those containing high calorie content foods helps prevent obesity. So what you consume as a child, what in your family situation, and what you do exercise-wise is critically important. Those habits carry over into adulthood. And in fact, when you develop cardiovascular disease or vascular problems, we know that it starts a lot of times as an adolescent. In studies of autopsies of kids killed in Vietnam, it was clear that a lot of them already had vascular disease, even at a very young age. So if you start early, have good habits, exercise every day, eat the right foods, you can help avoid a lot of those problems. Now, a lot of people are unfortunate in the sense that they're born genetically predisposed to heart disease. And no matter how good they are at taking care of themselves, how good they are about their diet, they still may develop heart disease. So it is important for those patients to have a physician that is going to be proactive with things like cholesterol management and with advising
the
surveillance,
exercise program, the different things you said, early on. Because, and the thing we have to realize when we talk about exercise, because a lot of our viewers are a little bit older, you can just start small. You don't have to start big. But the big thing about it, and just like every now and then because of my VAS conditions, I have to go in and have a thing called a stress test. Well, what they're doing is putting stress on the heart. And we find out that heart's it's pretty strong. It can do an awful lot, and it can take a lot of physical stress as far as from running or whatever it is you're doing, can't it?
The heart can, and it has a lot of reserves, and when people start having symptoms, it means that the reserves have been exhausted usually, and it's kind of gotten overstretched and the heart's gotten overworked. But that's not to imply that people should avoid working the heart in an effort to save it long term. Quite the contrary, if you exercise early and continue that exercise habit throughout your adult life, it'll be much better for you.
So what we need to let our viewers know is the fact that obviously diet is very important. Watch what you're eating. And of course, staying away from things that can cause a problem, such as cigarettes.
Absolutely.
Alcohol can. What about caffeine? Is it kind of I guess the school's kind of out on some days you hear, oh, caffeine's fine, then you hear, stay away.
I think the summary of all of the medical data, and there was an article not long ago in one of the cardiology journals, the summary is that for certain people who are susceptible to caffeine, they may have a few extra rapid heartbeats, but for the most of us, the majority of us, caffeine is fine. Not only fine, it may help reduce your risk of having serious cardiovascular problems. So I'm not encouraging folks to drink caffeine, but if you have a cup of coffee, it's fine.
I think the key there is moderation.
Yeah,
do everything you're doing in moderation.
And alcohol as well. Alcohol as well. Again, I don't prescribe alcohol for obvious reasons, but if people drink a glass of wine in the evening, it does not have any deleterious cardiovascular effects for most people.
but you have to be careful.
You have to be careful,
obviously.
absolutely.
And then, of course, number 3 was continued exercise.
Yeah.
Yep. Dr. Moore, thank you so much. This has been great. You've given us some great information. And just remember, it's your heart. You're responsible for your health. Take good care of it, but if you do need help, luckily this guy's here to help. We'll be right back right after this.